rapid access to comprehensive oncology data and survival analysis. This is the OncoToolkit.
All right, let's jump right in. In oncology, the stakes are always high and you never have enough time. We're going to dive into a cornerstone tool for liver assessment, the Child-Pugh Score, and show you how to get from patient data to an evidence-based answer instantly.
Look, your days are packed with complex clinical decisions. Time is the one thing you can't get back. This is all about cutting through the noise, swapping hours of digging through guidelines for a single reliable calculation you can do right at the point of care, so you can get back to what matters, your patient.
So, what's the fundamental problem we're trying to solve here? It really boils down to this one critical question. How do you get a reliable, quantitative handle on a patient's hepatic functional reserve, especially when they're dealing with cirrhosis? It's a huge deal because the answer shapes prognosis and pretty much every treatment decision that follows.
And that's where the Child-Pugh Score comes in. As you can see from the clinical background here, it's this incredibly well-established system that helps us classify patients and predict outcomes. We're not just talking about some abstract number. This score has massive real-world implications, guiding major decisions like surgical eligibility, treatment options for hepatocellular carcinoma, or HCC, and even who gets prioritized for a liver transplant.
Okay, so how does it actually work under the hood? It's beautifully simple, really. It breaks down this really complex picture of liver health into 5 core parameters that you're already gathering.
This table lays it all out. You've got 3 lab values that give you a window into liver function. Total bilirubin tells you about excretory function, serum albumin is a benchmark for synthetic function, and the INR, of course, clues you into coagulation. Then you add 2 crucial clinical signs you can assess at the bedside, ascites and hepatic encephalopathy. Each one gets a score from 1 to 3 based on how severe it is.
Now, here's where the magic happens. You add up those points and you land on a total score somewhere between 5 and 15. That score slots the patient into one of 3 classes. And as this table shows so clearly, the prognostic difference between these classes, well, that's night and day.
So if your patient is in Class A, that's a score of 5 to 6, they have what we call well-compensated disease. Their liver is still doing its job pretty well, and their 1-year survival, 100%.
But once you move into Class B, a score of 7 to 9, you're looking at a significant hit to liver function. And you can see that reflected right away in the 1-year survival, which drops to 80%.
And then there's Class C, a score of 10 to 15. This is decompensated disease, the most severe stage. The 1-year survival rate here is a really stark 45%. It just goes to show you how powerful this simple 5-point assessment really is.
You know, this score has stood the test of time for a reason. It wasn't just whipped up overnight. It dates all the way back to 1964 with Drs. Child and Turcotte. But the modern version we all use came about in 1973 when Dr. Pugh and his team made a brilliant modification. They swapped out a more subjective measure for the objective's prothrombin time and added the point system.
And here it is, the seminal 1973 paper from the British Journal of Surgery that gave us the score we rely on today. This is its foundation, a testament to decades and decades of clinical use and validation. It's about as evidence-based as it gets.
Okay, so we've covered the science, the history, the why. But how do you actually apply this accurately and in seconds when you've got a dozen other things to do? This is where the OncoToolkit app changes the game.
The app just makes this whole process effortless. You literally just tap in the 5 parameters we just talked about into this super clean, no-nonsense interface. No more hunting for a chart or trying to recall the exact scoring cutoffs. It's all right there.
And bam, instantly, you have the total score, the prognostic class, and the survival estimate. But this right here is the most important part. We don't believe in black boxes. The math and the reference tables are right here for your review. You just tap Show Calculation Logic, and it lays out exactly how it got the answer. Total transparency so you can trust, verify, and explain every single output.
But what if this tool could do more than just help you with one patient at a time? What if every single time you ran a calculation, you were also contributing to a powerful data set for your next big research project?
This is where we bridge that gap between clinical practice and research. The app lets you save every result, and then with a single tap on Export All to CSV, you can instantly convert all that clinical data into a clean, flat, research-ready file.
This creates this incredibly streamlined workflow. Step 1, you polish up your data. Step 2, you run your analysis. It transforms the routine work you're already doing into a pipeline for generating powerful new insights.
And the OncoToolkit ecosystem provides the tools to do it. You've got the CSV polisher to rapidly clean up that exported data, and in the survival analysis tool to generate publication-quality Kaplan-Meier curves and other stats with just a few clicks. It's the whole package.
So as you can see, this is way more than just a calculator. It's about building this seamless loop between your clinic and your lab. So the question I want to leave you with is this. What if every calculation you made wasn't just an answer for today, but a building block for your next discovery?